Hello, my name is Dr. Trevor Nichols, and I'm an orthodontist. I practice in Mesa, Arizona, alongside my partner and mentor, the infamous Dr. Stuart Frost. I'm really excited to be part of this podcast. I'm proud of that because I think it's great to get amazing professionals together and collaborate so that we can provide better outcomes for our patients and healthier and more beautiful smiles than we ever have before. And we do that as we collaborate together as a profession and help our patients. So excited about that. I thought what I would share is the 5 keys that we use to creating beautiful smiles. Part of this is we have to have a goal. We have to have an end in mind as we look to treat and plan our cases, especially from a cosmetic or aesthetic perspective. We have to have that artistic mindset to know where we want to go to be able to plan these cases effectively. So here are the 5 keys to creating beautiful smiles. Key number 1, creating beautiful mid-face support. This deals with profile, filling the lips with teeth, making sure that we have great fullness to provide graceful aging for patients so that they can age more gracefully. And the more full we can help the lips be, then the more graceful the patient will age over their lifetime. So number 1, again, is creating beautiful mid-face support. Key number 2 is the position of the central incisors. We want the central incisors to be centered on the midline using the philtrum of the lip with 100% upper incisor display on smile. We want to show 1 to 2 millimeters of gingival display, and we want about 1/3 of the upper incisor to display at rest. Part of this involves taking excellent records of our cases. If we don't have excellent records in photography, showing different static and mobile images of our patients, then we won't be able to diagnose and treat and plan the case effectively. So again, we want the centered midline on the face. We want to have 100% of the upper incisors shown upon smile with 1 to 2 millimeters of gum display. We want to show the golden proportions of the teeth. The central incisor should be 10 or 11 millimeters in length at the smile, and we want to have good harmony amongst the teeth. The 3rd key is arch width. This is the most important and the favorite key of ours, and that's creating smiles that showcase all of the teeth. These are 12 or 14 tooth smiles where the teeth are upright. We don't have flaring of the teeth. We don't have a lingual inclination of the teeth, but the teeth are functional and their placement of the bone, but that they have a proper buccolingual inclination. We want to have this to where that the central incisor introduces the lateral, and the lateral introduces the cuspid, and cuspid to bicuspid, and so on. If we have great arch width, it will help us create great mid-face support where we can show the teeth off and have these great, beautiful, broad smiles. Key number 4 is smile arc. And smile arc is where the incisal edges of the upper teeth follow the lower lip line. The central incisor should be the longest of the teeth, with about 0.5 millimeter or 1/4 millimeter difference between central to lateral, lateral to cuspid, cuspid to bicuspid, from front to back. This produces amazing transitions not only from a buccolingual inclination with arch width, but also from an incisal gingival position as we flow from front to back and each tooth introducing the next. We want to create these smiles where there's no distractions, but just beauty from corner to corner where we fill the space that we're given and that the incisal edges follow the lower lip line. That leads us to key number 5, which deals with the hard and soft tissue contours. This is providing great embrasures of the teeth from a hard tissue profile perspective, as well as great facial surface structures. This is making sure we have correct line angles within the teeth and again, good transitions from anterior to posterior. Incisal edges should be flat and contoured. We should have proper embrasures, starting smaller embrasures at the central incisor, graduating to larger embrasures as we transition from anterior to posterior. We also talk about gingival contouring, making sure that we get lasers or scalpels out to make sure that we have the proper gingival display with the same height at the central and the cuspid and 0.5 millimeter difference with a little more incisal position at the lateral incisor. As we create these great, beautiful smiles and focus on these 5 keys, we can create beautiful smiles for a lifetime and be proud of the work that we do as practitioners, and our patients can be proud of their results. They can wear their results every day like their favorite pair of shoes or favorite shirt, and we can be part of that transition and provide patients with such a beautiful smile. Thank you for listening. Go out and do something great for your patients today. Provide them with a great result and expectation and a great experience.